Hey guys, how's everybody doing? How's my medical coding family? Happy Monday. How's everybody doing? Yeah. Let's do some practice questions. Try to get TikTok involved here. See if we can't get this looking a little better. Slow down on your eating, honey. Had to yell at the boys to get their garbage picked up. All right, let me check on mail. What do you guys think is the answer for this question? Y'all put it into chat what you guys think is the correct answer. Why is that not showing up? There we go. Travi, turn your volume down. Whew, that is lopsided as can be. Lopsided. And you can't see nothing with this stupid timer thing up here, always on TikTok. I don't know why they keep putting that on there every time. All right. Neighbor's dogs a yapping. Let's see. Does that look better? Looks a little bit better on TikTok. Yay. All right. What do you guys think? Oh, y'all are saying D. Okay. Let me pick D. Perfect. Excellent. Next one. What do you guys think is your answer? Thank you for sharing the live. I'm glad I caught your live. I just wanted to say thank you a lot for your tips. You passed your CPC exam. Great. That is so awesome to hear, SR. Will you be hosting a CPMA boot camp soon? Says Chasing Sunsets. I have a boot camp ready for you whenever you get ready over here on my website at Medical Coding by Jen. And if you go over here to the far side where it says more, you click on that drop down menu right there. Fix that real quick. Click on the more. You get a drop down menu that will say, oops, wrong one. You will get one if you're not me, but you will get one that says video replays. When you go to the video replays, come on, computer. Go to the video replays. There we go. When you get there, you've got CPMA right there. And it is perfect for CP, your workshop right there. It goes over how to do the cases at the end of the exam, because 65 questions on the exam are patient charts, and you have to audit them, see if they were billed correctly. And I had an AAPC instructor ask me to make this workshop for her, and it is still legitimately the best thing I've ever done as far as making something for somebody. It's a great video to show you how to pass that certification. She was an actual instructor with the AAPC, but could not pass the CPMA certification exam. So I made that video for her, and it's exactly what I would just redo today. There's nothing new or different that I would do differently. That video is ready for you guys. I also have a set of CPMA notes that you can take and add to your book that will be everything that you need for the CPMA. So that is already there. And if you guys want to do the practice exam questions that I'm doing today with Pocket Prep, on the top of my website, I do have the banner for Pocket Prep right here. If you click on that banner, it'll send you to a link that you can create a brand new Pocket Prep account. So if you've ever bought Pocket Prep before but want better prices now than what you had in the past, just add in a new email address, create a new account, and this will give you a fourth off of Pocket Prep, which has never happened before. And Pocket Prep has 750 practice exam questions, all from AAPC point of view, and they are great. Absolutely great. Plus, you get rationale that will tell you where the answers are in your manuals. That's really awesome. No, Elizabeth, none of the boot camps are a one-time thing. You just need to go type the URL correctly in your URL. Go back to your history of the video when you watched it, in your browser, and go back to the day that you watched it and bring the link back up. When you purchase the boot camp from me, you download a PDF that has the URL in it. You just need to type it into the browser correctly, and it takes you right to the video. You can watch it an unlimited amount of times, and the URL will never change. Probably about 3.5 hours, sunset, somewhere around there. It's awesome. What do you guys think is the answer for this one? Clear your storage. Did that help? I rescheduled my exam for Saturday. Oh my goodness. Hey, Footbella. Good to see you. Hey, Tarantino. Good to see you. I guess I lost. I guess I lost the link if I cleared it. You shouldn't lose it. Like, you know, if you go to, if you have any access to the internet, right? You go to any Google page or whatever browser you're using, um, the three little dots in the top corner of any browser will bring up your history. And you can view your history for days of whatever you watched on whatever day. And the long history of whatever, you can go back to whatever day you last watched the video and then just click on it and it'll take you right there to whatever video. That's just one way of doing it. You can also go to your download history and view all the things that you've ever downloaded in your download files, which will have your PDF that you downloaded the day you purchased it. You can also go to your email if you were live and you watched it on the day of the creation of the video, and the link that you were supposed to use that day to get into the video is the link to watch the replay. It never changes. So, networking issues with the internet and trying to get really good at finding and um, troubleshooting little issues like that is a great quality to have, especially for a medical coder and you're trying to work from home. Invaluable. Play around with your computer. Don't be afraid of it. Ask your kids to help you out. Ask the neighbors' kids to help you out. Um, they're super savvy on those cell phones and computers too. So, what do you guys think is the answer for this integumentary one? Are we one code or two codes? And if we got to have two codes, do you need a modifier with those? Can you use the 15781 twice and just add the 51 modifier? Would you do the 86 and the 87 together without a modifier? Would you times the 80 code 15780? Where are we at? Integumentary. 15780 is dermabrasion total face. 1786 is for a single lesion. And then if you do each additional 4 lesions or less, you would add the 87. There would be no modifier. 86 is a single lesion. And then your 81 is just for segmental face. And yeah, you wouldn't do that twice. That's weird. What do you guys think? I got D's, A's, and B's. Oh my goodness. Yep, open book exam. If you're taking your certification exam outside the United States, in like Indonesia or the Philippines, you do not take your own books. Books will be provided for you on exam day. But as long as you're taking your exam either remote from home, inside the United States, or at a testing center in the United States, you take your own books. No one cares what you got written in them, so don't even start with that. No worries, no worries, I promise. You're taking one of your review exams now, says Libby. Everybody's saying, see, hey, Bluey. I Bluey passed. Yes, Bluey passed. Absolutely. Jen also teaches computers. Ooh, I don't teach it very much. I got my own struggles with it. You guys know it just completely um bogs down and dies sometimes even on me, and I can't even network the issue, and I have to call my kids over to help me. My oldest son is my IT director for a reason. Because I'm old and I have my own issues with the computer. Y'all were all wrong. Who said A? Who said A? Somebody did. That was Kim. You did good. So let's see what our explanation is. We did 2 segments of her face. So it does say inside our 15781 that it is segmental of the face. That means it is in each code. And if we did multiple segments, we would times it. In the 2020, let's see, 2025 book, it says the answer is on 111. I don't know where that would be. Page 111. Uh, their page number has to be wrong. Unless. No, this is all about the biopsies and breast biopsies. All right, our next question. What do you guys think about this one? 51 modifier is if you are doing a related procedure, but an additional procedure to what you just did. So if you're doing 2 procedures on the same day and they are related to each other, obviously we're dermabrasion the face, one segment, and then we're doing another segment of her face for the same reason, right? So they're related. If you're going to use the 59 modifier, they have to be 2 separate, distinct procedures for different reasons. Like you might be working on an ankle fracture, repairing that bone, and then you also did, I don't know, an OB/GYN visit or an ultrasound or for some reason. You know, the pregnancy has nothing to do with the fractured leg, and then the fractured leg has nothing to do with the pregnancy, unrelated things. Smiley's taking her CBCS exam next month. I don't know many employers who want that certification. NHA isn't something that a lot of employers want. Now, you may work for a particular company that wants it for some reason, but be careful about choosing that certificate or course. There's not a job market for that. If you do happen to have it and you didn't know that ahead of time, be sure to back up that certification with another one, either from AHIMA or AAPC. You can self study for AAPC just like I did. I have my CPC, my CPMA, and my CPC instructor certification, all with self study. No course needed. Just get the study guide, the practice questions, and practice away. In fact, Pocket Prep here has 750 practice exam questions. It's great for 40 bucks. I think it's even less. With 25% off, what is that going to be? $30 for 90 days access to 750 questions. It's great. All right. If prolonged services, what do you think? If we are at 99359, what are we doing? Well, nothing about medical coding is easy. So Janelle says, I wish self study was that easy for CPC. Yeah, I never said any of this is easy. It is a career, right? So it's not like it's just a job where you just need on the job training. This is a career. So you need to learn a new language for your career. So it's a challenge, but it's nothing that I couldn't do. I'm old, 54 years old, and I did this when I was, what, 49? Got my CPC in 2019, 2020, whenever that was. So, you know, I did first grade twice. You know, if if I can do this, anybody can do this. And I did it self-study. And Pocket Prep was great because with AAPC's practice exam questions, you don't know where the answers are. So I could reverse engineer with Pocket Prep, go find where they think they got the answer from, and then figure out why the wrong answers were wrong and then why the correct answers are correct. That helped out a whole lot. Glad I found them. Can you guys even find these codes in your CPT book, right? A lot of these codes are out of sequence. Some of them are in the front of the book, some of them are in the back of the book. Do you even know where they're located, right? Some of that, it's crazy. Some of the codes get pushed out of the way. Thank you for all the roses. Good to see you, Elena. How are you doing? If you're in the 2026 book, I'm on page 32. We got C's and B's for the first hour and then each additional 30 minutes. We have an hour and a half. So you guys think the answer is one says B, one says C. I got 1A. Oof. There's a chart on page 32. You can just look at the chart. It's got the minutes in there and the hours. It'll tell you what the answer is. Let's see. Video. And we can move that up here. Yeah. There's a little chart in your CPD book with those codes. Just look at the time, an hour and 30 minutes, and your answer is right there. Page 34 of the 2025 book. Okay. I'm so glad you found me too. I'll be 46 in a couple of weeks, and I'm just coming into coding. Yeah, I think I was like 49, I guess. B was correct. Good job. Let me get that off the screen. Here's your next one. What do you guys think about this one? There she goes with all them roses again. 54 too, Sabrina. So if it's coming from another human, then that means you are not in the driver's seat, right? So autographed means it's your body part, you're driving the car. So I think about auto as you're driving the car. If it's somebody else's body part, then they had to cut it off as somebody else and walk it over to you. So I always use the two L's in allograft as like somebody had to use those sticks to walk somebody else's body part over to you. So allograft means another human or somebody else's, right? Xenograft, man-made graft, those kind of things. 3D printed, whatever. So now what do you guys think is the answer? Good job. Allograft is A. What do you guys think about this one? Third-degree burns. Burns are on page 107 if you're in the 2026 book. There's the link if anybody in YouTube wants to use it for getting pocket prep. The cheapest I've ever seen it. That's going to be like, if you bought a year's access, it would be like $7 a month. It's a really good deal. I've never seen them give 25% off ever. The most I've ever gotten off was 15%. My subscription's paid up for a whole year, but just in case somebody wants to use it, it's a really good deal right now. We got lots of B's. Are you a 30 or a 35? Do you know what the SKIMMING means? Right? Or did we do 30, which is a child code? We got to go look at mama, which means we got to go look at 20, right? Our 16020, which is dressing and debridement for 5% of total body surface area. What did we do today? We did 3 incisions. So yes, B is our answer. Good job. Perfect. What do you guys think right here? If we intubated a 15-monther, providing an hour and a half of critical care time, what do you guys think is the answer for this one? Nine 466 is critical care, inter-facility transporting, pediatric patients 24 months or younger, right? Our 71 and 72. Our 71 is for kids that are inpatient pediatric critical care that are for 29 days to 24 months. And then 72 is subsequent hospital visit for inpatient critical care, 29 days to 24 months. Are we doing interfacility transport of a critically ill patient? Because 66 and 67 are for transporting a patient. What do you guys think is the answer? What about TikTok? Anybody over there telling me what you guys think? What do you guys think is the answer? Y'all think C? C is correct. Yep. Just think about 66 as, they would be in like an ambulance or, maybe even helicopter transporting patients, right? It doesn't matter that they did an hour and a half. This is per day critical care for this patient. So 71 would be per day, technically, but it's okay that they documented how much time. All right. What do you guys think about this one? Our 77 is in initial hospital care per day under continuous intensive care services. 68 is our initial inpatient neonate critical care services. 79 is subsequent intensive care. And we know our 66 is our interfacility transporting a patient. So, what did we do for this patient today? Do you see any transport? If you don't, then you know 66 is out. Hey, Patrice, good to see you. How are you doing, dear? Lots of people say B. 68 is for neonatal critical care. Are you sure? The patient was admitted to intensive care unit. What codes are under intensive care unit? Look at your red headers above your CPT codes. All of the above. Huh. Well, we're not transporting a patient, so we know we're not 66. 68 is for critical care. 77 and 79 are under initial and continuing intensive care services. A critically ill newborn was admitted to intensive care unit due to respiratory by provided by the critical care services. Earlier the same day, the newborn was admitted to the hospital by the same physician. What is the correct code for the services? What do they mean by earlier the same day? Would this have been a subsequent visit? Kind of interesting. They were admitted by critical care services into the neonatal intensive care unit. Very interesting. So we got both words here. I got A, B, and C. It is B, because the critical care services are the ones that did the admitting. Very cool. This question in the 2025 book can be answered on page 51. Work on this one. What do you guys think about this endocrinologist visit? Would we have a regular consultation visit? If so, what level would we do, 42 or 43? Or is this a new patient visit? Or is the patient admitted to the hospital and this is a hospitalization consultation? Check your patient status. 68 is critical care services, but 77 is for intensive care services. We weren't billing for that yet. We were only billing for the critical care services that got them admitted in the first place. So it's very crazy. Critical care did admit the patient to intensive care services, but only after they performed life-saving measures in critical care to get them stabilized enough to go to intensive care. Intensive care is for like monitoring your heart. You got to monitor whatever's going on, their oxygen levels, their heat maintenance, their vital signs continuously, right? They're under intensive care services. But critical care services keep you alive because you're actively dying. Yeah, the wording of that question is complete garbage. You can't really tell, am I billing for the morning visit or for the afternoon second visit? You know, kind of sort of the orders for intensive care, or am I billing for the critical care? Yeah. Yep, yep, yep. A new patient to an endocrinologist visit comes into the office for hypothyroid consult. The visit lasts 30 minutes and they do a medically appropriate history and exam and a straightforward MDM. Which one of these is straightforward? Our 99203, isn't that low? You have to meet or exceed a level to be able to bill it. Which one of these is straightforward? $203 is low. If we look at 242, you're looking at straightforward. You're looking at 243, you're looking at low. And 252 is also straightforward. It does say office, so you know you're not inpatient. 30 minutes. True, true, true. What trumps MDM or time? What would you be able to bill? 20 minutes for 4-2 4-3 is for 30 minutes. And then 203 is also 30 minutes, but low MDM. I got A's and B's. D is a hospitalization consultation. A is correct. They wanted the straightforward. Now, technically, aapc would make sure we would have a request from a primary care physician to see this patient in the question somewhere. You would see the visit done, and then you would see a report written back to the provider in the question so that you would have all 3 R's before you would bill a 424. But keeping up with which one was straightforward was key here to pocket prep and knowing that you were in an office. Ooh, standby services. What do you guys think about this question? Can you even find the code in your E&M book? Do you know where it's located at? It's on page 35 if you're in the 2026 book. New patient would be like self-referred. I took myself to a specialist because I want to know if, I have this. It wasn't a referral, no consultation was requested. That's when you would do a new patient. Can you find your 416 or your 367 codes? Do you know where they're located? If you did standby services, and something took a little bit longer, 6-7 is medical team conference of a team of healthcare professionals having a 30-minute conversation about a patient. And that didn't go on. The physician or her was just standing around waiting, seeing if there was an emergent need for them. But their time is valuable since they were concentrating on just the single patient this time, standing by for over an hour. What would your answer be for an hour? Because you've got 30 minutes up here during a C-section. And then, however, it went longer and stayed an extra 30 minutes because the C-section took longer than expected. Total time was an hour. What would be your answer? Vicky says D. Page 37 in the 2025 book. B says Sabrina. 416. 416. which is an add-on code. And you know that because a code that has a plus symbol in front of it can never be the only code billed for services that day. If your code has a plus symbol in front of it, then that means you have to have a parent code that goes with it. You will have two codes, one code that goes in front, and then this add-on code is always going to be your secondary code attached to a primary CPT code. So if you ever have any available answers and the only available answer is one code and that code has a plus symbol in front of it, then you know it can never be a correct answer for anything that they're asking you to code for a day or for a visit. Hey, Bill, how's it going? Indeed, A is your answer for that one. Times two, it is an each um, CPT code. It has the word each inside of it. That means you always times this code if you go over and above and exceed its minutes, right? All right, what do we code for this I and D? Spook, thanks for the follow. 99367 was a medical team. There was no team conference. There wasn't like a counselor and, a case manager and two different physicians all sitting around for 30 minutes talking about the same patient's care. It was not a team conference. That was just standing by waiting to see if something went wrong on a patient. It's definitely standby services, which was 99360. All right, this one is an incision and drainage. What do you guys think here? Good job, Vicki. Amanda says D. Anybody else? Field also says D. It was C, guys. Oh my. 100. Go over there, those codes. I was just trusting you guys. I didn't get there. 100. Where are they? 10060 was for a single simple, where 61 was for multiple or complicated. How many did we have? We had a large infected one. And it does say the word complicated right there, too. Anything documented as large or complicated is definitely your 61. Indeed. This lovely website is Pocket Prep. So, how you get there? Let me turn off my camera. Oh, TikTok's want me to make the puzzle. Let me do the puzzle real quick. There we go. And then let me get rid of that. And then if we go here, so if you go to my website, medicalcodingbyjen.com, you'll see in my top header of my website the banner up here that says 25% off right there with the little brain guy right here. That's Pocket Prep. If you just click on that, it'll take you to Pocket Prep. Now, what's going on when you get to Pocket Prep, you obviously won't see this page that I have, but you'll see a page that will say, let me see if I can bring it up. it'll say create an account, is what it's going to say. And let me see if I can bring it up in a different thingy. Nope, it keeps taking me to my activations. Okay, there we go. Um, Ooh, 3 months is only $29. Oh my gosh. So Pocket Prep has 750 AAPC practice exam questions with page numbers where the answers are located at. It's so cool. And using that coupon from my little thing is going to get it to you um, for $29. Oh my goodness. That is awesome. That's better price than I've ever seen with Pocket Prep. And like I said, they have 750 practice questions in all 18 areas of Pocket Prep. Um, and they have a pass guarantee too, which is super helpful. You can make up your own exams, like your total missed questions. You can build an exam. You can do the top 10 questions, your most missed. You put in your exam date too, and it will let you know, right, what you need to do each day to get prepared. Like if you're 5 days away, it'll have advice for you. Um, and it's really cool. It's really cool. You can do your weakest subject. You can do, it comes with free 30 questions that you can check out and do if you want to for free. Um, but it'll keep up with your stats. It'll let you review all the questions that you've already answered, and you can build your own mock exam. So it's really cool. Love Pocket Prep. I've had them for years and years. But let's get back to our questions. What do you guys think is your answer right here? We got that one for the 61, and we know why now because it was complicated. All right, here's a good guideline question. For our codes 99497 and 98, what kind of services are being coded with those codes? What do you guys think? Google is usually the best place to get the books. You can search for AMA CPT book 2025 or 2026 on Google Shopping. Put in some alerts for when it goes down in price and have it search the internet for the cheapest price with free shipping. If you're going to take anything that is AAPC related, get their ICD-10 book and HipPix book because they have decision trees in them and a lot of bonus information that's not available in Optum's books that they might quiz you on. So, any AAPC certification, I do recommend their books, but you don't have to get them from them because they charge you like $30 extra just to ship you all 3 books when Amazon has free shipping. So just Google. We love TikTok. Good to see you. What do you guys think is the answer to this one? Thank you for the 2,500 taps, all the roses, all the heart me's. Yep, we are doing medical coding practice. Y'all can ask about anything medical coding related. I'll see if I can't help you out for sure. eBay has some auctions. I like McCary. McCary's great. I've even seen some books on Poshmark. Yes, it's an open book exam. Absolutely. What do you guys think is the answer? C? Perfect. Good job. All right. What about these? Blood pressure. Oh, this is where I practiced all my process of elimination and looking for similarities, getting it down to just two codes just by looking at the numbers numerically, and then looking at the differences between those two codes. This is where I developed my process of elimination. Ooh, yeah. I have the business of medicine notes ready too, if anybody's interested in writing those down into their books for 2026 year. I have those done and ready as I'm going back to our 99 codes. 99, where are we at? We got work related, for disability insurance. Yep, 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 yep. Or medically disability evaluation services. Then our differences between 55 and the 56 is knowing whether it's other than treating physician or examined by the treating physician. What do you guys think? Y'all like C? 50. They switched it up on you guys. You look at your answers for, what did they say the page number was for this one? We've got page 46 in your 2025. What does TBSA mean? And don't forget, inside your HIPICS book, if you have AAPC's version, you have Appendix C, which is an acronym dictionary that can help you out too. What do you guys think is the answer for this one? I've never seen Pocket Prep $29 for 3 months access. It's a really good deal. It's crazy. Indeed. B is correct, Carolyn. Very good. All right, what do you guys think about this one? Are we doing a medical team, which is our 66 and 67? knowing whether the patient is present during the conversation or not makes a difference in some of these codes, so be careful about that. Thank you, New York, for all the roses. Thank you, thank you, thank you. Page 46 includes the blood pressure. We did a team conference without the patient that lasts 35 minutes long. C is correct. Good job. Good job. What's the definition of consultation? Is it a type of E&M service, an official consent, or a follow-up visit? Y'all are saying C, an official consent that a physician can initiate diagnostic or therapeutic services during the same or subsequent visit of initial services? What is the definition of a consultation? Oh, okay. A. Good job. Perfect. What do you think about this integumentary one? 110s. 55, 56, and 57. A. Perfect. Just one. Good job. Can you find these codes in your E&M section? Be sure to check out your headers for the codes. Think about the guidelines to be considered inside that header before picking it. Almost 5,000 taps on TikTok. Thank you guys. Let's see, how many do we have? 25 viewers on YouTube. That's awesome. We had 14, 15 likes on our YouTube um, live lesson today. That's awesome. Everybody saying B for our initial nursing care facility. Perfect. This software is called, if you go to my website, medicalcodingbyjen.com. Let me get this back up here where we had it. If you go there, there's a little banner up here at the top with the little brain on it, and that is for Pocket Prep. They are running a sale right now for 25% off. I've never seen them do that. So for $29, you can get access to all of Pocket Prep's practice questions. They have 750 from AAPC that they that they have inside their system, and they do they even tell you where the answers are inside your manuals. That's really cool. And if you go to medicalcodingbyjen.com, the top banner of my website has the little brain logo that you guys can click on right there, and it'll take you right to the coupon. Just register a new email address and purchase 3 months, and you get access to all 750 practice exam questions. And they're just like what you would see from AAPC, but instead of $80 for 150 questions, you're getting 750 for $29. And you get access. It's great. They're lovely. I've used them since 2019 and never seen them run a sale like this. So I just was trying to make sure you guys saw their sale. I've been a user of Pocket Prep since 2019. I've got a year membership, but I paid more for the year than you guys are um, at the current rate. So it's awesome. I love it, especially since they tell you where the page numbers are. And since I self-studied, Pocket Prep was great for me because I need to know where the answers are. And they tell you what page number in the CPT book the answer is or the guideline is at. And doing the questions in reverse once I figure out what the answer is and looking up why each answer is wrong also helped. Since I self-studied and did the CPC and the CPMA and the instructor certification, all with self-study, Pocket Prep was invaluable. So I love it. So are we doing a consultation, either outpatient, inpatient? Are we in the ER? What is our patient's status right now? And which one of these has a moderate MDM? If you want to switch to AAPC, all you need is the AAPC study guide, which I have on my website, and you can use my teacher discount if you want to and get it cheaper than you can even get it on AAPC's website or Amazon. You need the study guide, and then you need the practice questions. I also have practice exam questions from AAPC, a little bit cheaper than what you can get them from AAPC. The problem is you need to practice inside AAPC's electronic system because your certification exam is going to be in Scorpion. And it's an electronic program that you need to learn and feel comfortable in before you take your exam on that day. And since their practice questions are also inside Scorpion now, it's great to at least get one set. And I do have and recommend D, E, and F. I don't like A, B, and C. I think they're too easy, but I do like D, E, and F. So I have that in my store too at a discount. So all you need is the study guide, the practice exam questions D, E, F, and then I highly recommend you getting these 750 practice questions for $29 from Pocket Prep and just practice questions. Practice as many questions as you can find. Getting these and understanding why the answers are what they are and practicing them and then doing the live lessons with me on Mondays or watching my replays on YouTube is all you need to do. You can pass right away. Then you just have to buy your certification, exam attempt, and your membership when you get ready to take your exam. That's all you need to do. But if you buy the study guide and your practice exam questions from me, you don't need your membership yet. You can hold off on that and not have to have your membership. It's kind of a backdoor in to get into doing the practice exam questions without the membership so that you can save for it. Maybe ask Santa for it for Christmas. All my videos are good for CCS also. My very first person I ever helped pass their CCS exam was Jeanette back in 2019. Everything I do is geared towards both. I even have videos on my YouTube channel for PCS. In our Discord study group, I have a room just for AHIMA with practice questions, and I even post PowerPoint presentations when I attend your AHIMA meetings. And there's any slides that I think you guys should see, I post them inside your Discord room. So you've got everything you need from either certification entities right here from me. Same codes, same medical system. No difference. Thank you for the roses. I will not be taking the CPC exam for a long time. Should I still purchase the Pocket Prep 750 questions? Absolutely. Get access for a whole year because that gets your price down to $6 a month if you just pay it all in advance. $6 times 12 is what, $60 right now in their biggest sale ever. And just start practicing. You'll have access for a whole year. And even if you're not ready, just playing around in these exam questions, you get an alert and you can do the exam question of the day. It's awesome to play around in here. And because you're going to have to learn a lot of language and it takes time. And playing around in here is really nice. And there's never going to be a better price for Pocket Prep. I've never seen them since 2019 do this type of sale. So if it's something you're thinking about doing in the future and you know you are going to do it, then go for it. Go on and get Pocket Prep. 750 questions and get a whole year access. It's great. Like $60. That's wonderful. I paid $98 for mine. Did everybody get C for this one? C is correct. What about this one? Think about your entities here. We've got moderate MDM. Which one of these is moderate? Which ones are not? Keep in those key factors. Sure. If you guys go to my website at Medical Coding by Jen, right? The free resources right there has a social media page, and that's where our Discord link is. Also, if you're on TikTok, you just go to my blue logo in the top corner and click on my profile. The Discord number is typed into my profile, but all my social media links like RedNote, Twitch, Discord, Facebook, Pinterest, LinkedIn, Instagram, YouTube, they're all listed right there under the free resources. There's free blog lessons that have free practice questions, free job resources, free book prep page and videos. All that stuff is underneath the free resources. If you want to join and take a course from AAPC and have me be your teacher, you can do those course options. If you want one-on-one tutoring, those options are there. I do have a Saturday class coming up, which is just going to be $6, which is on Zoom lesson. If anybody wants to participate, you guys can join in. It is a group class for all of us, but that's happening next Saturday at 11:30 Arizona time zone, just $6. There are practice questions, of course, on my website that I have a membership for. For $8 a month, you get access to all my practice questions that are available interactively on my website, which are all these pages. So you get to do oncology, anesthesia, cardiology, all kinds of bonus practice questions. But if you're ever looking for any of my video replays, my CPT book prep notes, anything for CRC, CPMA, or AAPC products to purchase, like the study guides or the practice exam questions, those are all in that drop down menu that say more. But hopefully you don't need to purchase anything from me. You can get everything from free. You can just use the social media links, watch all my free thousands of YouTube videos that are completely free, and just get you a study guide and some practice questions, and just hang out and never have to spend a dime with us. The Discord group is totally free also, and all the practice rooms and stuff inside of it too. You can do a search feature in Discord and ask, like camera, and it'll bring up every conversation anybody's ever had in Discord about a camera and which one do you use. I also have an Amazon list right here that you guys can click on that pink bubble, right? And it will send you over to my Amazon list about which ink pens do I use, where do you get your books, how do you make a lazy Susan, what chair do I use, what highlighters do I use, anything. How do I keep my books from unraveling? I use these needle stopper little hats to put on the end of the books. When my hands start hurting, I use these red light therapy stuff. I use the Bark phones for even my 17-year-old teenagers still have Bark phones. They do not have Instagram. They do not have Snapchat. They don't have none of that stuff, and they use a Bark phone, and they're 17. I also use, which keyboard do I use? Which mouse do I use? Which desk do I use? all that kind of stuff is all here. What pens do I use? It's all listed there on my website. Don't be afraid of it. There's nothing here that won't, um, um, you know, is to try to sell you anything. It's just holding information for you guys. So, but the best thing I've got going right now is that freaking Pocket Prep 25% off. I cannot believe you can get 3 months for $29. That's crazy. Crazy good. Crazy good. All right, let's go back to our practice questions for today. What did you guys think was the answer to this one? Everybody saying C? Yeah, it was A, guys. Don't forget about your header that we were doing initial admit nursing services, and it was performed at a separate site. What about these? What is an SNF, ICF, or an LTCF? What are those? We got A's and D's. If you're near your initial or nursing facilities, right? You've got your skilled nursing facility, SNF. Yep. You've got all of those listed there. So D would be correct. Yes, yes, yes. Another I and D. What do you guys think is the answer for this one? For those that are on the YouTube channel, I'm going to give away 5 memberships to my YouTube channel. For $5 a month, you can get access to all my book prep videos, our old duck classes, our old workshops that are older than 90 days old. You get access to the podcast or my CPC course stuff that I'm putting out. There's a lot of bonus material stuff that you guys can get if you become a member of my YouTube channel. And I just gave away 5 memberships to Shava Patrice. Yay. Divas, Jody. Congratulations, guys. I hope that is super helpful for you guys there on YouTube. And having those subscriptions is super helpful for you guys. What do you guys think is the correct answer for this one? We got B's. Yep. Just needed to look for the correct verbiage inside the CPT code descriptor. What about this glass window? It has wreaked havoc on this patient. What do you guys think is the answer for this one? Thank you for the 10 shares and the 11,000 taps on TikTok. We got 13 super fans on TikTok. Oh my goodness. Thank you so much, guys. Another C. C is correct. Good job. What about this one? We have a wound on the trunk. Where's the trunk? What do they mean when they say trunk? Is that the nose, like an elephant? What are they talking about? Where's that body part? You may know what that body part is. Buttocks. Trunk is your chest or back. That is your chest area, thoracic cavity, or back. Yep. Buttocks is sacral. Another name for it. I feel like I sound like Forrest when I say buttocks. Ooh, my cell phone's about to die. I forgot to plug it up. 17%. Uh-oh. Let's plug. Thank you for the roses, Jess. How are you doing? How's this CPMA going? What do you guys think is the answer? A? Got somebody that says an A. I didn't look up the code, so I'm going to take y'all's word on it. What do you guys think? Abe says B. Ron says B. Alexa says B. There we go. Yeah. You get down, see the process of elimination or looking for similarities get you down to just these two codes, the 51 and the 52, and they're super close together. Just look at your differences and then pick out your answers. I always like to play around with the process of elimination or similarities and look at my differences. 5, 8, 51, and 52. One of them is requiring anesthesia, and one of them does not require anesthesia. And 52 says dressing change for other than burns. So making sure that you pick something for the right diagnosis under the right conditions. Super helpful. Oh my gosh. My surgeries, my favorite. The only thing you have to worry about in figuring out which your answer is usually just body parts here, right? If we're an 11, we're pretty much everything. If we're a 13, we're arms, legs. That does not mean hands and feet, but we're arms, legs, or trunk, right? So the front of our chest or our back or our arms and legs. So we just have to go look for our body part in this question. That'll tell us whether we're an 11 or a 13. That's always the first step in anything that says Mohs or Moz surgery, however you say it's pronounced, um, is figuring out what body part you are and if you're an 11 or a 13. If you're dealing with cartilage, nerves, anything sinuously, you're always going to be 11. If you go to the body and cut something off, that's called a stage. If you go back to the body and cut something off of it again, that's called a second stage. And as long as both of those stages or each stage only has 5 or less blocks each, you do not add in this area at all, then you do not add the code 15. If any of your stages produce a set of blocks that's over the number 5, then you have to add in the code 15. We did have 2 stages. So we know we're going to add a secondary code. Our first stage was 5 blocks. Our second stage was 3 blocks. We do not add. Both those numbers are less than or equal to the number 5, so we do not add the 15 code. So we know because we have 2 stages, we need to have 2 CPT codes. And because our body part is trunk, which is our back, shoulder, lumbar, thoracic area, we know we're a 13. B is our answer. Yes, yes, yes. I have on my YouTube channel, if you ever go to the post tab inside my YouTube channel, I have free practice questions that are interactive, like you just pick and click on what you think the answer is. And I have probably over 100 that I've posted, and I've got quite a few for Moz surgeries, and it's just free. They're not videos or anything. They're just posts that I made of typed out words on YouTube, and you can actually go to them and they look like this. They're in this format, and you pick an answer, and when you do, it'll show you the rationale. And they're all free, so super helpful. Don't forget to go check that out. But I'm still super impressed with Pocket Prep, of course. 750 questions. I can't compete. And they come with the page numbers inside your CPT book where the answers are. Invaluable information. I love that part. I don't even have that feature on my website questions. I wish I did. Sorry, Mama. Mama Shelley. What do you guys think about this question? If we're doing a mastectomy, which answer would we be? Are we in the 1900s, the 1900s, or the 19200s? A lot of times you can just use the very first page in Intigmatary to figure out what answer will be, meaning this page, right? It's got a list of all the codes, and they're usually divided up by if your second and third digits are different, the second and third digits, if they're different, then they're under a different blue header, right? So if you look at the 19100, those are under the breast, right? If you look under the 19300s, we're under mastectomy. If you look under the 19200s, you're under introduction into the breast, right? So just using these pages is usually all I use to pick out my correct answer. A lot of times, super handy dandy. You can also use your alphabetical index in the back of the book and just look up this word, and it'll probably have a division about simple or complicated and tell you exactly what the answer is. C is correct. Good job. Perfect. Ooh, look at this one. It's got lots of fancy stuff in it. Would we times? Would we use the 59 modifier? Would we use a 26 modifier? What's going on? If each answer was correct, these two procedures would be separate and distinct and not related, right? And does the times 4 come after the modifier usually? If we did these procedures, then that means one of them, like the 55 code, somebody has to be an add-on code because there's no modifier letting us know that these procedures are related in any way, shape, or form. It's just kind of interesting to think about and look at. They don't change. It takes a committee. Congress writes these code numbers legitimately. CMS, they all have to be voted on. A committee gets together, they create the codes. These codes have been in place forever, right? Fine needle aspiration biopsy without imaging guidance has been that code, and that way, and it's always been that code since 2002, right? Our very first integumentary code. It's been that code since 2002, and it never will change because payment for procedures are tied to that for years, you know? There's no big major updates every year. Now, we may add to a set of codes, add in a couple of new ones. We might delete a couple of new ones as technology evolves and we create new procedures for certain things and we stop doing certain procedures, but it's very limited. You know, usually it's 1 to 2 to 4 codes in a section each year, but it's not every section. Like anesthesia hasn't had a new code since I've been teaching since 2019. The section hasn't changed, it hasn't had any new codes. And I just keep rewriting the same notes every year. It's kind of monotonous. So, not very often, not worth mentioning, not really worth a lot of stress over. So don't worry. Um, we had some updates in cardiovascular this year, and in the male genitalia, finally got some new codes in that section. We've needed it for a long time. That section also hasn't changed since 2019. It never had any out of code sequences either, ever. Finally, now it does. So that's pretty cool. Um, but not a lot to stress about. Every year, I make a document for you guys that you can download and turn a prior yearbook into a current yearbook so you don't have to buy a brand new book each year if you didn't pass your certification exam during one year. I've already got the one up for 2026. So if you have a 2025 book and you don't want to purchase a 2026, you can turn your 2025 book into a 2026 right now if you want to. Yeah, just advanced technologies. I'm in OBGYN and the pelvic code changed. Yeah, we had a new add on one for the pap smear last year, but I bet it's denied, 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 denied by everybody. Somebody's here. Let me go see who this is. Grandma, he cannot have Starbies anymore. You gotta have chocolate milk, something that's not got caffeine in it. Ooh, my mom got Starbucks for my heathen children and was bringing it in. Like, quit giving Travis caffeine. He can't have caffeine. My baby, my middle child was just diagnosed with superior mesenteric artery syndrome and renal compression, and here she is buying him lattes. His blood pressure's like 150 over 80, and I'm like, Mom, but she's 75, you know, and it's like, you can't really scold her too bad. She can do as she pleases, but like, got to get her into a new routine of getting him something different than a frappe or something. He's got to find a different drink that he likes from there. All right, what do you guys think is the answer? By saying A? A is correct. Very cool. We did biopsies of the prostate, but we also did needle placement under ultrasonic guidance, probably leaving little markers behind so we know where we're going to put chemotherapy or some sort of radiation therapy later on. Team conference again. Try this question. Sorry, baby. Ruth, I didn't see your comment till now. A lot of them are just now getting paid for the add-on code. The pelvic pain code changes. Yep. As of 10/1. Yep. They do not like generalized pain diagnoses. You really need to say what the pain is coming from. And God, don't order any diagnostic testing just on pain. Your pain has to be documented as chronic or acute before you can even diagnose it and put it on a claim. That's one of your guidelines in your ICD-10 book. You don't bill pain unless it says it's acute or chronic. And then it's not going to cover anything that you bill for it. You need to be more specific. Is it ovarian cystic pain, or is it endometrious pain? What's causing what's the root cause? They absolutely hate pain. Very generalized diagnosis. There usually needs to be an injury if it's associated with C-section scars or um, anything that you can think of that it could be related to is what needs to be diagnosed with it to get coverage. UHC will not approve a chaperone code. Yeah. And Aetna is now down coding all 99214s to a 213 when medication management is probably 90% of what all 99214s are, right? You're evaluating and rewriting patient prescriptions, and they're down coding those to just a low when it's in the guidelines that medication management is a moderate. Insane. Would drive me insane to be an auditor right now. I'd be stressing. That's why I like HEDIS measurements. HEDIS measurements don't get involved with billing patients and getting coverage. HEDIS measurements just audit physicians. Are they using and getting patient services done? Pap smears, mammograms. Are they overutilizing x-rays or writing too many prescriptions for antibiotics? Are patients able to pick up all 12 months of their prescriptions? Or are they having issues with getting things refilled and only got 11 of their 12 months prescriptions because of delays in doctors refilling their meds? Then the doctors get dinged for that. So that kind of stuff. I love auditing HEDIS measurements. Um, that's where I found my niche in healthcare. Loved it. Blue Cross Blue Shield makes us send the record to Optum. Yes, every single time. Absolutely. Blue Cross Blue Shield has the highest threshold for any audits or expectations. I always set them as my bar for any health plan because if I can meet Blue Cross Blue Shield's requirements, then all the other health plans would be easier, of course, to meet. A is correct. Good job, guys. What about this one? Are we a new patient or are we established? What's up, go kart? Clara, we got somebody who passed. How long in the field? Beans. Oh, she was talking about her job position. Okay. If they don't give you MDM or time and you have to do it based off of problem list, based off of the data that was reviewed and the risk for the overall visit. Remember, you might have separate components that you can count, like an independent historian, like a parent, because the patients might not be able to speak for themselves. B is correct. Yep, we do have some prescription management in here. Perfect. What do you guys think about this one? We've got a lesion that we're removing. You guys that have been with me long enough should be able to just look at the available answers and know exactly which one it would be based off the lesion and what we were doing to it and how we removed it. They used a scalpel, but they shaved it. What is our code for shaving? Brenaboo says C. C is correct. Be careful. Just because it says benign and it says scalpel doesn't mean that we're going to bill our 14. You seriously, you gonna have to change your lifestyle. Superior mesenteric artery syndrome. You do too. I asked Lafredo. It's not related to the other issue. It is a separate finding, baby. There's no getting around that. You do have it, and your blood pressure is high. Did you check your blood pressure today?
No, you want to check it right now?
Did you already drink your caffeine?
No.
Okay, yeah, check it when you sit down and relax, breathe, and then check it and see what it says. Mom got me Starbies too. It's 8 o'clock at night here. Why are the kids getting this DoorDash to them? And we live in the boonies. I mean, boonies. She must have called them at closing time. My mom can drink coffee at bedtime and go right to sleep. It doesn't affect her. I've never grown up on coffee, never had coffee of any sorts. So this stuff will have me wired for days. It's too funny. All right. Which one of these? Simple closure for a full thickness tissue sample? Oh, interesting. What do you guys think? Anybody else like that? Jeez. I think a frap is mostly milk, so maybe it won't bother him too much, but geez. Ice cream. He's lactose intolerant. That superior mesenteric artery syndrome cuts off your small intestines at the duodenum level. So giving him ice cream or milk products is just aggravating everything. He has to suffer with this tummy ache. Oh my gosh. All right. What do you guys think? Are we timesing anything here? There be a reason to times two anything? Would it be one code or two codes? I can't drink coffee at night. A lot of sugar. Yeah, I know. B? Good job. Yeah. There's nothing there that says anything about two of anything. And so you wouldn't build two codes separately and you wouldn't times anything. So the only possible answer have to be B, one code for one sample. Speaking of OBGYN, how would we bill for services here? How long does it take to really get this? Oh, this is a career, my love. Spark. This is like, it'll take you forever. Like, you couldn't spend a lifetime in all this mess and know it all, right? This is a career. This is ever changing. The rules are always moving. Just because it was this way today doesn't mean it's this way tomorrow. Very good blood pressure. Very good blood pressure. That's really good.
Do you want me to send it to you so you can keep it sent?
Thank you. 106 over 77. Much better blood pressure. Um, so what we're talking about here today and playing around with is just in general. This is might be the code that you would pick, but based off the different insurance policies, plans, like United Healthcare won't bill a particular code, or Medicare won't even use CPT codes. They don't even use this book. They only use HIPIC's book. So it's a total craps game, right? If you were at the casino, I guess you'd have better odds at picking out the right codes at the casino than you would in real life trying to do this. You will have policies and procedures in place at whatever job you get, and it will be set for the way they want things done, and they'll train you on the job. But when you go to another job, it's going to be different. Um, I worked out of California, and we never even billed for lab and path. There was no claims for that. We just sent all of our patients to LabCorp and we wrote them a check once a month to see and do labs for all of our patients. So all of our lab recs, it didn't matter if we put a diagnosis code on them at all. We just needed to check the boxes for the correct CPT codes. We put in a claim, but we zero it out and we just keep it for tracking info, right? But it's not put in as a claim and sent off, but we put it in so we can track it. It's going to be all different and it's always going to be new. If you don't like learning new stuff all the time, if you if you don't like change, this is not the career for you. Um, but if you love learning something new, figuring out puzzles, and can find a way to turn it into a game so that you can mentally find it challenging, right? To figure out. That's what I did. I always turned it into a game. And if there was, I did HEDIS measurements. So if my group could get better HEDIS measurement scores than any other group in California, we would get awards. Kaiser Permanente outdoes everybody in California because they have a central system. It doesn't matter if you see a psychologist. If your mammogram is due, they can get your mammogram done at your psychologist office visit, right? Because they have everything in house. They own the mammograms, they own the lab, they own the psychologist, they own the internal medicine doctors. Everybody's in house. So no one needs to be referred out or contract out. It's everybody's responsibility to get everything done anytime a patient walks in. So it was very hard to beat Kaiser for their scores. So I would put their scores as my goal, right? And beating Kaiser became my little obsession at work so that I could give myself something to do that made it challenging so I stayed invested in the job, right? And won a couple of awards for that too, so it was really nice. A? You think it's A, user? You're correct. Good job. Perfect. Healthy babies, happy babies are always a 6'4". When they come out blue and they need resuscitation, they're always 65. Blue babies are 65, happy babies are 64. What do you guys think about this one? CPC or CCS? I like CPC simply because for the price, you can get 2 attempts at the certification exam. For $499, you get 2 attempts at your certification. What I did was I took my certification exam right away just so I knew what was on the exam so I could prepare to study for my second attempt. I used the first attempt as a learning session because I didn't want to just start studying stuff unless I knew what was going to be on the exam. So I went and took the exam right away, came up with a study plan after I saw the exam, right? And then I studied and passed the exam for my second attempt. With ahima, with CCS, you only get the one attempt for $399, and then you got to pay another $399 to do a second attempt. So, simply because of that, employers look at both as the same, and it didn't affect me at all. A lot of people say inpatient hospitalizations or something like that is better with CCS, but either of them will definitely get you in the door. They are both highly marketable. You can go on Indeed yourself and do a search for CPC versus CCS, and see what jobs pop up in your area. But legitimately, those are not the jobs that you are going to be applying for when you get the certification. You're going to be looking for jobs that are under risk adjustment or HEDIS actuary, or, there's a ton of names of things, IDNR, um, reconciliation. There's so many positions that either one of those certifications open up the door for, that you can literally do so much in medicine. It's shocking what all you can do if you just have either or. Um, so I have no qualms about either one of them. I'm just trying to find the cheapest and fastest way possible for you guys to get a foot in the door, to start making better money, have better job security, and get anybody and whoever is in retail or pharmacy, front line, customers yelling and upset, and you can't give your patients their meds, or bedside, you can't treat them with medicine or treatments that will fix or cure them because somebody else is saying no. It's just devastating. It's just the hardest job ever right now to deal face to face with people, because you can't, your hands are tied, right? So get behind the scenes in medicine and have a secure job that's not berating you 100%, but that is always changing, and is interactive and fun, and job security, right? What do you guys think is the answer for this one? A, coder extension, the lesion diameter and the narrowest margin, minus the greatest incomplete excision, plus that margin required for a complete excision. A or D? What do you guys think? And if you guys want access to 750 practice questions, don't forget about Pocket Prep. I've got that link in my banner at medicalcodingbyjen.com. It'll save you 25% off. You can get 4 months worth for $29. And it's all 750 practice questions. They even have 75 cases that you can practice, because we do have on the CPC exam 10 cases at the end that you have to do. Super cool. I built this exam to be all E&M questions and, of course, integumentary. And you can build your own exams and work on whatever codes you want per day at any time. I like doing the questions on my phone, even like in the grocery store line or something. D is correct. Good job. Perfect. That one's one of the cases. I'm going to skip it because it won't fit into frame. How about this one? Are you an established patient? Which one has a low MDM? Nine 99308. I got on TikTok. Amy, good job. Perfect. What about this one? If we're doing cryotherapy on 35 AKs, which answer is correct? These have some interesting CPT code descriptors that go along with these 17,000 code. They always seem to trip people up. Just the way the code descriptors are written. What do you guys think? I've got 1A. This is for 35, right? Your code description for answer B, right, is for just the first lesion. If we have additional lesions after that first, we would add the O3 up to 14 lesions each. That means if we had 13 of those, we would do the 1700 code, and then we would do the 003 code times 12. But since we've got over 14, we're just going to use the 17004, which does all of them from 15 or more. So if we have 99 of them, it's still the 17004. These codes will definitely be on your certification exam. Another recommendation to have is have some AKA names for certain things, like your 17106 is a vascular proliferative lesions. What does that mean? What kind of lesions does that mean? Like port wine stains, Mongolias, hairy nevus, those kind of things are your vascular lesions. We've got other notes that you can add in for different. All right, let's see about our next code. Our next question is dealing with just an established patient. What do you guys think is the answer for this one? Are we straightforward, low, moderate? What would we be for this one? I've got copies of my notes on my website at Medical Coding by Jen under the More tab if you need them. But I also have instructions under the free resources that show you how to make up your notes, just like mine. I have videos listed there. I also have a membership on the YouTube channel if you want to watch me do book prep. Inside each section, I have videos recorded there. 99214 for changing their medication. We've got again our medication management. Good job. Oh, our AKs again. All right, you guys try this question by yourself without me. What do you guys think is the answer for this one? Thank you for the follow, Tanya. What do you guys think? 21,000 likes. Super cool. Travis. 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 I'm live. You want me to take away the coffee? Why? Why are you making fun of their choices? That's not nice. Make you take a pumpkin pie or something. James, did you hang up your clean clothes? Or do I need to take that bag of clothes and throw it away? Oh, he needs to hang up his clean clothes. He's going to refuse to do it until I make a stink about it. Would we use the 51 modifier? Would we times codes in this area? Or would we just add them? How many altogether did we have? We had 4. So which answer equals 4? It is B. Perfect. Do we have a consultation? Do we have a discharge? Or do we have a subsequent hospital visit? Knowing your headers by sight for your E&M questions is super handy dandy during your CPC exam. I do have a PDF that is flashcards for E&M, and underneath the free resources, if you go to the free practice exam question area, there are 3 quizzes that are flashcards for E&M that you can do interactively on my website for free, or you can just print out the PDF inside my shop for the flashcards for E&M so that you can learn the headers by sight of your E&M visits. It's just super handy dandy. What do you guys think? What did we do for this patient today? We did discharge for 45 minutes. Remember, you have to meet or exceed a level to be able to bill it in E&M. You can't just sort of get there. or almost get there. Make sure you met and exceeded a certain guideline. As long as you did, then great. B is correct. Good job. What about this one? Another fine needle aspiration. Would you add radiology to these codes? Would you times them? And would they have a code that you would add with it? How many lesions did we have? We had 3. Which one equals 3 and also has the ultrasound guidance that you need for this one? What do you guys think? B again? Indeed. Are you established patient, a new patient, or an office consultation? Which one has a moderate MDM or equals up to 50 minutes of time? What do you guys think? Nine nine two one two oh five. That means you met the requirements of them, the highest E&M visit you could possibly do. The time involved in a 99205 must meet or exceed 60 minutes. It's at a high MDM level. You need 2 of 3 components to meet the requirement of extensive or high to be able to bill it. Another B. B is correct. We are going to stick with our moderate MDM, and we met the requirements for time, which is 45 minutes. It's okay that we did 50 minutes. Critical care. Don't look at the CPT code descriptors. Look at the chart for critical care services. Key in your time utilized for that and look and see what your answer is based off the chart given to you for critical care services. Best way to do that one. What do you guys think is your answer? It's not B this time. Can tell you that. We also have a vascular access that was added. So they're just asking if you guys know inside your book where this coding tip is located next to your critical care chart that tells you what you cannot code with critical care services because it's already included. So they're just seeing if you know where that's located. Vascular access is listed inside that coding tip. So we know our answer is A. Yep, perfect. What do you think about this anatomy one? Closed fracture is perfect. Yay. All right, guys. I have been live 2.5 hours, so I got to end it here because the live is going to be too long to get rendered up onto YouTube. So I hope this was super helpful. We'll do it again next Monday, which is December 1st. Also, this Saturday, the 29th, I have a $6 class on Zoom. If anybody wants to join in, it's where you guys will do practice exam questions on your device by yourself. I will send you inside Zoom your own little quiz. You'll get 3 questions, and then you guys have to answer it with your books all by yourself with no chat helping you pick out the answer. No one else is going to be able to see what you answered, including myself, but you'll get an average and you'll get to see what the answer is after we grade it. And that way you'll know whether you got it right or wrong. This is a great way to see if you're ready for your certification exam. And it's a great way to not have to do it this way where you get influenced by chat and seeing what everybody else says the answer is. So you'll also be timed 2 minutes per question, 120 seconds per question, and you'll face that alone, right? So it's very crazy. You think it's 6 minutes for 3 questions is enough time, but it really goes by so fast. So I hope to see you guys for that class on Saturday. And don't forget about the Pocket Prep link in my website banner. It's a really great price. I'm not just trying to promote Pocket Prep. You guys know I've used it for years. And I've just never seen a price like this from them, and I think it's great. If you guys do use the link, then they know I did send it to you. And every once in a while, Don will send over my rep from Pocket Prep. He'll send over something. And last weekend, he sent over a $25 Starbucks card. It was really nice of him. But any money that I do get from Pocket Prep, I do send right back into you guys as free YouTube memberships and stuff like that. So super cool. I hope this is helpful more than anything for you guys. And I can't wait to see you guys on Saturday. Tomorrow, we've got our CPC course students. So I'll see you guys tomorrow. Sherry, Go Kart, some of the other ones. Um, I'll see you guys tomorrow at 11:30, and we'll do our next chapter in our CPC course. We're getting very close to the end of all 21 chapters, which is very exciting. And then we'll just start the course over again. But um, I will see you guys on Saturday. Otherwise, I hope this was super helpful. And if y'all need anything, y'all just email me. Love you guys. I hope this is helpful.